Uh, Good morning, everyone. The topic of my case presentation is hemangioma of nose, which is presented by myself, Dr. Arushi Bhardwaj, under the guidance of Dr. Tarunoja sir. I am presenting a case of patient Harsh, son of Sunil Kumar, who is a 5 years old Hindu male. He is a resident of Nirman Nagar, Jaipur. He is a student coming from middle socioeconomic class who came to the ENT OPD with the complaint of bluish discoloration over the nose since childhood and the complaint of epistaxis since childhood. The significance of name is that it is for the identification of the patient, for developing rapport with the patient, for maintaining the record of the patient, may help in identifying the unknown religion. The significance of age is that in young people, nasopharyngeal angiofibroma, rhinosporidiosis, and atrophic rhinitis is common, and in elderly, carcinoma maxilla is common. Significance of sex in males, nasopharyngeal angiofibroma, which is exclusive in males, rhinosporidiosis with the ratio of male is to female, that is 3 to 1. In females, atrophic rhinitis is more common, with the ratio of male is to female is 1 is to 5.6. The significance of address for demographic distribution of disease. Rhinosporidiosis is very common in Jharkhand, Chhattisgarh, Madhya Pradesh, and West Bengal. Atrophic rhinitis is more common in tropical countries like India. Rhinoscleroma more common in northern states of India, and Plummer-Vinson syndrome is more common in the central part of Gujarat. Significance of occupation is that in farmers, rhinosporidiosis is common. In dusty environment, vasomotor rhinitis is common. Nickel, chromium, and arsenic workers, septal perforation is more common. Uh, the significance of caste is that the Baudiya community, Mahar of Vidarbha region of India, has more incidence of sickle cell anemia, hence episodes of epistaxis are more common. The Sindhis and Bhanushalis of regions have more incidence of thalassemia major and have more episodes of epistaxis and bleeding disorder. Now we have the modified Kuppuswamy classification, in which there are three categories: education of the head of the family, occupation, and the total per capita income. So in education, there are 7 grades. First, if it is a the person has a professional degree, then the score is 7. If he is a graduate, then score is 6. If he is an intermediate or diploma, then the score is 5. If he is from high school, then the score is 4. Middle school, the score is 3. Primary school, the score is 2. And illiterate, score is 1. Occupation of the head of the family, if he is a professional, then score is 10. Semi-profession, score is 6. Clerk, shop or farm worker, then the score is 5. Skilled worker, then the score is 4. Semi-skilled worker, then the score is 3. Unskilled worker, the score is 2. And unemployed, the score is 1. The total per capita income, if it is 2000 and above, then the score is 12. If it is between 1000 and 1999, then the score is 10. If it is between 750 to 999, then the score is 6. If it is between 500 to 749, then the score is 4. If it is between 300 to 499, then the score is 3. And if it is between 101 to 299, then the score is 2. And if it is less than 100, then the score is 1. The total scores. If the scores are between 26 to 29, then it belongs to the upper class. If the score is between 16 to 25, then it belongs to the upper middle class. If the score is between 11 to 15, then lower middle. Between 5 to 10, then upper lower. And if below 5, then lower. The chief complaint, the patient came to the ENT OPD with the following chief complaints. Complaint of bluish discoloration over the nose since childhood and complaint of epistaxis since childhood. History of presenting illness. As told by patient's mother, the patient had swelling over the nose with bluish discoloration since birth. It was insidious in onset and gradually progressed in size over the next few years. The bluish hue intensified with time. Patient's mother also complained of bleeding from nose since childhood. Patient has the habit of picking nose. Bleeding was insidious in onset and intermittent in nature, not mixed with any type of discharge, non-foul smelling. No positional or diurnal variation was evident. It was relieved after taking medications in form of nasal drops or after applying pressure with no aggravating factors. Negative history. There's no history of discharge from swelling, no history of pain in swelling, no history of fever associated with swelling, no history of loss of body weight, no history of headache, lacrimation or itching in nose, no history of disturbed smell, and no complaint of feeding during childhood. Differential diagnosis of swelling over the nose, congenital cases like dermoid encephalocele or meningoencephalocele, glioma, nasoalveolar cyst, congenital nevus. Acquired cases like furunculosis, vestibulitis, fractured nasal bone, fibrinolysinoma after injection of fibrinolizin. Differential diagnosis of swelling over the nose, benign like rhinophyma or potato nose, rhinoscleroma, papilloma, comedo, adenoma sebaceum, hemangioma, telangiectasia, pigmented nevus, seborrheic keratosis, neurofibroma. Pre-malignant like actinic keratosis and keratocanthoma. Malignant tumors like melanoma, basal cell carcinoma, squamous cell carcinoma, and Kaposi sarcoma. Now, differential diagnosis of discoloration of nose. Red discoloration seen in rosacea, nevus flammus, drug-induced hyperpigmentation, Strug-Weber syndrome, Kaposi sarcoma, idiopathic telangiectasia, herpes simplex infection, ophthalmic zoster, and DLE. Blue discoloration in ochronosis, lichen planus, nevus of Ota, lenticulomaligna melanoma, porphyria cutaneous tarda, glioma, blue nevus, basal cell carcinoma, pigmented type. Brown discoloration in randioslar Weber syndrome disease, pemphigus vulgaris, and herpes simplex infection. Epistaxis, the causes are first local causes like in nose, trauma, infection can be viral, diphtheria, tuberculosis, syphilis, foreign body, neoplasm like hemangioma, papilloma, carcinoma, sarcoma, deviated nasal septum, atmospheric changes. Nasopharynx, adenoids, GNA, and malignant tumors. General causes in the cardiovascular system can be hypertension, arteriosclerosis, mitral stenosis. Disorders of blood vessels like aplastic anemia, leukemia, thrombocytopenia. Liver diseases like hepatic cirrhosis, kidney disease like chronic nephritis. Drugs like salicylates and other analgesics. Acute general infections like influenza, measles, chickenpox, whooping cough, rheumatic fever, typhoid, pneumonia, etc. Vicarious menstruation and mediastinal compression. These are the arteries which are involved in epistaxis. There's branches of internal carotid artery, like anterior and posterior ethmoidal artery, which are the branches of ophthalmic artery. From external carotid artery, there's sphenopalatine artery and septal branch of greater palatine artery, which are the branches of maxillary artery, and there's septal branch of superior labial artery, which is the branch of facial artery. Now, the importance of negative history. Discharge from swelling can be seen in sinusitis. Pain and swelling is present in case of nasal vestibulitis, trauma, sinusitis, nasal furunculosis, sarcoidosis, nasal septal perforation, etc. Fever associated with swelling in case of sinusitis, allergy, allergic rhinitis, abscess, etc. Nose swellings associated with loss of weight can be seen in basal cell carcinoma, squamous cell carcinoma. Disturbed smell in case of nasal polyp, sinusitis, etc. Past history, there's no history of hypertension, diabetes mellitus, ischemic heart disease, TB, asthma, bleeding disorders. There's no history of allergy to dust and smoke. There's no history of blood transfusion in past, no history of sexually transmitted diseases, no history of drug allergy, no history of surgery in past, and a history of normal institutional vaginal delivery. Personal history, diet is a vegetarian, appetite normal, bowel and bladder habits normal, sleep adequate. Family history is not significant. Immunization history is completely immunized for age as told by mother. Mamta card is not available. Importance of past history. If there's a history of evening rise in temperature or loss of weight or appetite can be seen. In case of tuberculosis of nose, can be nodular or ulcerative. In case of lupus vulgaris, history of blood pressure. If blood pressure seen in case of epistaxis, relative contraindication to surgery. Diabetes mellitus can be seen in cases of fungal infection of nose, asthma, in associated with nasal allergies, allergy in case of allergic rhinitis, vasomotor rhinitis, ethmoidal polyp, asthma. History of sexually transmitted diseases like syphilis, gamma, or septum, yaws, and nodules in nose. History of any medical or surgical treatment in the past. History of vaginal delivery associated with trauma at the time of birth. Importance of personal history. History of excessive use of nasal decongestant hypotensive drugs is associated with rhinitis medicamentosa, chronic nasal obstruction. Importance of family history. History of similar complaints in the family seen in case of epistaxis, and history of bleeding disorder, hypertension, diabetes mellitus are associated with family history. General examination of the patient. The patient is conscious, cooperative, and well oriented to time, place, and person. Patient is well built and nourished. There's no pallor, icterus, clubbing, cyanosis, generalized lymphadenopathy, or pedal edema seen. Uh, Vitals of the patient. The blood pressure is 100 by 70 mmHg in the right brachial artery in sitting position. Pulse is 90 per minute, regular in rhythm, rate, and volume in right radial artery. The respiratory rate is 20 per minute, abdominothoracic type. Temperature is afebrile on touch. A systemic examination, CVS, first and second heart sounds present and no murmur heard. Respiratory system, vesicular breathing present, bilateral air entry equal, no additional sounds heard. Central nervous system, the higher mental functions normal, per abdomen soft, non-tender, no hardening, no rigidity, no organomegaly. Significance of general examination is that general examination is done for proper diagnosis and differential diagnosis, for selecting the patient for anesthesia, to decide the type of surgery to be done, and to predict the prognosis. Mental state. The mental state and level of consciousness should be assessed in general, but in particular in specific clinical situations like head injury, hepatic and septic shock. Glasgow Coma Scale. The three categories are eyes, verbal response, and motor response. So, in eyes, if there are 4 points, if eyes open spontaneously, then four. Eyes open to verbal commands such as speech or shout, then three. Eyes open to pain, then two. And no eye opening, and then one. Then one verbal response. If the patient is oriented, then 5 points. Confused conversation but able to answer questions, then four. Inappropriate response word, then 3 points. Incomprehensive sounds or speech, then 2 points. And no verbal response, then 1 point. In motor response, if the patient obeys command for movement, then 6 points. Purposeful movement or to painful stimuli, then 5 points. Withdrawal from pain, then 4 points. Abnormal flexion or decorticate posture, then 3 points. Uh, extensors response or decerebrate posture, then 2 points. And no motor response, then 1 point. GCS in intubated patients. Patients who are intubated are unable to speak and their verbal score cannot be assessed. They are evaluated only based on eye opening and motor scores, and the suffix T is added to the scores to indicate intubation. In intubated patient, the maximum GCS score is 10T and the minimum score is 2T. Built and nutritional status. The built is structural organization of underlying skeleton. It is related to the age and sex of patient. Person is said to be malnourished if the BMI is less than 18.5 or has lost more than 5% of the body weight during the last 3 to 6 months. Infants are said to be malnourished if weight of for height below -3 standard deviation. Visible severe malnourished wasting and presence of bipedal edema according to WHO classification. Nutrition is the proportion of soft tissue structure like muscle, soft tissue, and fat in relation to the bony structure. Protein deficiency causes rough skin, brittle hair, and edema feet. Fat deficiency causes cachexia, hollow cheeks, and loss of fat in hips, abdomen, and subcutaneous tissue of elbow. Pallor. The pallor is checked in lower palpebral conjunctiva, mucous membrane of the lip and cheek, nail beds, and palmar crease. Causes of pallor are massive bleed, shock, dysphagia, throat carcinoma, nasopharyngeal angiofibroma, iron deficiency, anemia, atrophic rhinitis, and epistaxis. Icterus, it is due to deposition of bile pigment with excess of it in the plasma, checked in the upper sclera, better seen against white background and by asking the patient to look for his feet and clinicians pull the upper eyelid upward. It can also be checked in nail bed, earlobe, nasal tip, and on the undersurface of tongue. Cyanosis, it is due to the raised level of reduced hemoglobin in the blood, causing blue or purple discoloration in the skin and mucous membrane. A minimum of 5 gram per dl of reduced hemoglobin should be present in the circulation to cause cyanosis. Peripheral cyanosis is checked in nail bed, palms and toes, tip of nose. Tongue is not involved in peripheral cyanosis. Central cyanosis is confirmed by checking the tongue, nail bed, palms and toes. Cyanosis is seen in foreign body bronchus with lung collapse. Cyanosis is also seen in obstructive sleep apnea and choanal atresia. Edema. It is the collection of fluid in interstitial space or soft tissues. Edema will be clinically evident only when fluid accumulates more than 5 liters. Pitting on pressure is the cardinal sign of edema. Conditions in ENT with edema are myxedema, angioneurotic edema, cachexia in malignancy, liver metastasis carcinoma, metastatic lymph node pressing on lymphatics. Pulse. The normal pulse is between 60 to 100 per minute. Five characters of pulse can be examined are rate, rhythm, volume, character, and radial delay or peripheral pulses. Tachycardia is seen in pulse rate more than 100 per minute, as seen in pharyngitis, tonsillitis, fever, sepsis, severe pain. Bradycardia is decreased pulse rate that is less than 60 per minute. Blood pressure. Hypertension is persistent raised systolic that is above 140 or diastolic above 190 mmHg BP. It is sustained elevation of systemic arterial pressure. It is seen in thyrotoxicosis, raised intracranial tension. Hypotension is diminished BP, where systolic is less than 90, is seen in cachexia of malignancy, TB, anemia, functional causes. Respiration. Tachypnea, where the respiratory rate is more than 20 per minute, is rapid breathing seen in hypo or hyperthyroidism, metastasis, fever, shock, hypoxia, acidosis, tetany, or hysteria. Gradual deepening of respiration alternating with short periods of apnea is called as kind stroke respiration. Fever or rise in temperature. The normal temperature is between 36.7 to 37.5 degrees Celsius. A diurnal variation of 1 degree Celsius is normal. Lower temperature is during morning 2 to 4 a.m., highest being in afternoon. Fever is increased in body temperature more than 1 degree Celsius or more than the maximum range. The sites are oral, axillary, or rectal. Types of fever. Continuous fever, where the fever persists throughout the day and does not fluctuate for more than 1 degree Celsius in 24 hours. Remittent fever. The fever is above normal throughout the day, but there is a fluctuation of more than 1 degree in 24 hours. Intermittent fever. The temperature is present only few hours a day and reaches to normal. When fever develops daily, it is called as quotidian. When fever develops on alternate day, it is tertian. And when it occurs every third day, it is called as quarantine. Local examination inspection. A single 2 to 3 centimeter in size swelling is present at the tip of the nose. It is bluish purple in color, diffuse, and the surface appears smooth. The edges of the swelling are well defined. It is a non-pulsatile swelling. DD of inspection, the situation. Few swellings are peculiar in their positions. Example, dermoid is a midline nasal swelling. Encephalocele of the nose is present at the root of the nose or side of the nose. Glioma can be present as an extra nasal mass. Nasolabial cyst is situated at the junction of globular, lateral nasal, and maxillary process. Rhinophyma is usually present at the nasal tip. Basal cell carcinoma commonly present at the tip and ala of nose. Squamous cell cancer commonly present at the lateral wall of vestibule and columella. The color gives a clue of the diagnosis. Example, if the red color, then rosacea, nevus flammis, drug-induced hyperpigmentation, Sturge-Weber syndrome, Kaposi sarcoma, idiopathic telangiectasia, herpes simplex infection, ophthalmic zoster, DLE. Blue color in ochronosis, lichen planus, nevus of Ota, lenticulomaligna melanoma, porphyria cutaneous tarda, glioma, blue nevus, basal cell carcinoma pigmented type. Brown color in radiovascular Weber disease, pemphigus vulgaris, and herpes simplex infection. The shape. Avoid pear-shaped, spherical, or irregular. Size, horizontal or vertical dimensions are noted in centimeters. Edge, clearly distinct from surrounding tissue. Example, pedunculated, which has distinct border and elevates from the adjacent tissue. Nodular, which has distinct border and fixed to the underlying tissue. Number, the single can be cyst, lipo, or lipoma. Multiple, like tubercular lymphadenitis or neurofibromatosis. Hemangioma. Vascular lesions can be broadly classified into two groups, hemangioma and vascular malformation. Hemangioma are the most common vascular lesions present in the infancy and childhood. These lesions are present at birth and up to 10 to 12% of with the female is to male ratio of 3 to 5 is to 1. Extremely premature infants are at particular risk with around 30% affected. Facial hemangiomas are mostly found in segmental distribution with particularly a long line of embryological fusion. It can be congenital, which is present at birth, and infantile, more common, which proliferates from original pink macule during first 2 months of life. Cutaneous lesions appear as a patch of erythema, a blanched area, or telangiectasia with peripheral pale halo. Involution of hemangioma tend to begin at around 1 year of age and continue for 5 to 7 years. Early age of first involution is associated with improved outcome. They do not have genetic basis, but some cases may be inherited in autosomal dominant fashion. The palpation to confirm all the findings of inspection. The smooth surface of consistency, smooth margins, mobile in both horizontal and vertical planes, no local rise in temperature or tenderness present, and no fluctuation in the swelling present. The swelling is compressible but non-reducible. It is non-pulsatile on touch. There is no fixity of swelling to the underlying skin. Significance of palpation and the temperature. Local rise due to increase in vascularity of the swelling due to infection. Tenderness in case of inflammatory swellings or neoplastic swellings may or may not be tender. Pulsations, swelling arising from the arteries are pulsatile like aneurysms. Surface, smooth surface in case of adenoma, cyst, lipoma, nodular in case of multinodular goiter lymph nodes, irregular in case of carcinomas. Consistency, variable in case of malignancy, stony hard in carcinoma, bony hard in osteoma, firm in fibroma, soft in lipoma, cyst and chronic abscess. Margins, well defined in neoplastic or chronic inflammatory swellings, smooth in benign swellings, irregular in malignancy, ill defined in acute inflammatory. Fixity to skin, fixed in malignancy, palpation of cervical lymph node is to be carried out to rule out hard, fixed lymph nodes seen in carcinoma. Now the skin over the nose on doing the local examination, the skin over nose is bluish purple. The vestibule on both right and left side appears normal. On doing anterior rhinoscopy, the nasal septum on the right side, there is a lesion present in lower one third of the right side of the septum, and the left side appears normal. Nasal mucosa is pinkish on both sides, which is normal. Right nasal floor, nasal cavity, inferior turbinate and inferior meatus are normal on both right and left side. Middle turbinate and middle meatus were not visualized on both sides. Bilateral paranasal sinus tenderness is not present. Cold spatula test is normal and the cotton wool test is normal. Posterior rhinoscopy, the posterior part of the nasal septum is normal. Both choanas are normal. Roof and posterior wall of nasopharynx is normal. Opening of eustachian tube is normal bilaterally, and fossa of Rosenmuller is normal bilaterally. External examination of the nose, depressed nasal bridge seen in leprosy, syphilis, and TB. Nasal injury common in road traffic accidents. Deviated nose common in boxers. Congenital swellings seen in gliomas. Benign conditions like rhinophyma, potato nose. Broadening of the nose seen in antrochoanal polyp. Frog face deformity seen in GNA. Crepitus seen in fractured nasal bone. Acne rosacea, typical butterfly rash over nose and cheek. Dermoid cyst as a discharging sinus at the osteocartilaginous junction of the nose. Furuncle as a tender red swelling at the tip of the nose. Enlargement of bony skeletons in Paget's disease or fibroosseous disease. Cartilaginous enlargement in chondroma and chondrosarcoma. Ulcer or neoplasm in basal cell carcinoma or squamous cell carcinoma. Herpes zoster or simplex. Woody feel in rhinoscleroma. Now the differential diagnosis of anterior rhinoscopy, the nasal septum, there can be septal spur, septal deviation, septal dislocation, septal perforation. It can be iatrogenic or syphilis, bony septum, tuberculosis and cartilaginous septum, granulomatous disease, leprosy. Snuff takers perforation seen in tobacco or cocaine addicts where it is being snuffed. Chromium perforation and chrome workers due to acid fumes. Pick ulcer perforation due to picking of an ulcerated area. Nasal cavity, if it is narrow, then the septal deviation or hypertrophy turbinates, polyp or growth. Wide in case of atrophic rhinitis. Discharge can be mucoid, mucopurulent or purulent or blood-stained. Nasal mucosa is normally pink. If there is generalized congestion, it can be seen in common cold, rhinitis medicamentosa, pale and allergic rhinitis, dry and crusted and atrophic rhinitis. Normally seen as a concave tunnel. Floor of the nose defects in case of cleft palate or fistula, swelling in case of dental cyst, neoplasm in case of hemangioma, or granulation in case of foreign body of osteitis. Turbinates enlarged or swollen in case of hypertrophic rhinitis, vasomotor rhinitis, small or rudimentary in case of atrophic rhinitis, congested and inflammatory, and pale and allergy. Inferior and middle meatises, discharge or polyp in the middle meatus in case of infection of maxillary, frontal and anterior ethmoidal sinuses, and between the middle turbinate and the septum, posterior group of ethmoidal sinuses. The oral cavity examination, the mouth opening is adequate. The lips, gums, GP sulcus, teeth, Flora of mouth, buccal mucosa, hard palate, and anterior two-thirds of the tongue are normal. Oropharyngeal examination, the bilateral base of tongue, uvula, soft palate, anterior and posterior pillars, tonsils, and posterior pharyngeal wall are normal. Larynx, bilateral vocal cord mobile, rest all structures bilaterally normal. Laryngeal crepitus is present. Neck, there's no swelling or cervical lymphadenopathy seen. Ear, the preauricular region, the postauricular region, the external auditory canal, and the tympanic membrane are normal on both right and left side. The Rennie's test is positive on both right and left side. The Weber's is lateralized to both sides. The airborne conduction is equal on both right and left side, and the seventh cranial nerve is normal on both sides. The provisional diagnosis of my case is hemangioma of nose. The investigations to be done are first routine investigations, hematological and biochemical investigations like hemoglobin, which is reduced in case of malignancy and chronic inflammatory swellings. Total or differential WBC count in case of increased in inflammatory swellings. Platelet count, ESR, which is raised in malignancy and chronic inflammatory swellings. X-ray PNS Waters view, COVID-19 RT-PCR, HRCT chest, and chest X-ray PA view. The management injection sodium tetradecyl sulfate is injected over the dorsum and tip of the nose in this case. The mechanism of action of sodium tetradecyl sulfate 3% IV injection. When injected into the vein, the sodium tetradecyl sulfate causes intima inflammation and thrombus formation, which typically results in occlusion of the vein. Subsequently, fibrous tissue forms and cause partial or complete vein obliteration that may or may not be permanent. Side effect of sodium tetradecyl sulfate 3% is that common side effects are mild headache, nausea, vomiting, discoloration of the skin along the treated vein may be permanent. Injection site reactions like pain, hives, ulcerations, allergic reaction like hives, hay fever, asthma, and severe anaphylaxis. Other treatment modalities in case of hemangiomas, like treatment is decided based on the local and systemic effects of lesion and associated complications. For small lesions, active monitoring and reassurance for patient will usually suffice. Lesions which are large and affect functions, causing complications require non-surgical and surgical intervention. Non-surgical treatment like propranolol is found to be very effective. Vasoconstriction, a direct beta blocking effect, will allow hemangioma to become soft and pale. In some cases where propranolol is less effective, other treatment include corticosteroids. Side effects of corticosteroids are more like rebound lesion, growth, Cushingoid phases, and growth retardation, etc. Other treatment modalities include chemotherapy and radiotherapy, which have been shown to arrest proliferative phase of hemangiomas. Immobilization is occasionally attempted for large, highly vascular hemangiomas. Surgical treatment like excision is done in cases which do not respond to propranolol and other medical treatment. Laser therapy using a variety of types like carbon dioxide, pulse dye, anti-arc, KTG, and argon are used predominantly for cutaneous lesions. Now, question and answers. What is Orngrens classification asked by Dr. Almas? It is an imaginary line between medial canthus and angle of the mandible dividing maxilla into two parts. It defines a plane um, orthogonal to a sagittal plane dividing maxillary sinus into one, an anterior inferior part infrastructure and a superior posterior part suprastructure. Next question asked by Dr. Praveen. What are the various tests done to test patency of nasal cavity? Answer is cold spatula test, cotton wool test, and Cortell's test. What is Calvin syndrome? Asked by Dr. Bevan. It is anosmia, congenital hypothyroidism, and delayed or absent puberty. Hypogonadotropic hypogonadism. What are the common sites of basal cell carcinoma of external nose? Asked by Dr. Bhargavi. It is the tip or ala of nose. Next is what are the risk factors for squamous cell carcinoma of nose? Asked by Dr. Monica. It is smoking, nickel and chromium fumes, fumes from leather industry, mustard gas, etc. What are the most common congenital tumors of the nose in children? Asked by Dr. Nirvika. It is gliomas. Then, what are the most common site of osteoma paranasal sinus? Asked by Dr. Manan. It is frontal, then ethmoidal, then maxillary. Then, what are the causes of trismus in sino-nasal malignant neoplasia? Asked by Dr. Nishant. It occurs due to involvement of pterygoid muscles. Thank you.